inclusion and social development in Peru. You have at most 15 minutes, and the floor is yours. Thank you very much. Can you hear me? Yes, we can hear you. Perfect. Thank you. First of all, I'd like to welcome you all on behalf of Ligero Tiada, the Minister of Social Inclusion and the General Director of the Non-Contributive Pension Program, Dr. Freddy Solano, as well as myself, of course. I'd also like to welcome you. Throughout the next few minutes, we will be sharing specific information about the intervention of the national program for people with disabilities, the continuous program. Let me share my presentation with you, our presentation with you. Can you see my presentation? We can, yes. Perfect. Okay, so the National Contigo program is a social program that is part of the Social Inclusion and Development Ministry, which wants to improve the quality of life of the population and build different capabilities, and this includes an intersectional effort within the public sector as well as the civil society. And it includes two very specific matters: social development and social protection for the most vulnerable people. The Ministry of Social Work includes different specific interventions that are focused and that prioritize certain capabilities for people to have access to these goods and public services. Within the framework of public policies and social inclusion towards 2030, which is called PENDIS, we have a life cycle, and including the Contigo, according to the Contigo National Program, it looks at the entire life cycle of a person from the moment they're born until they're elderly people. So since we have time constraints, let's look at it directly. The National Contigo program is one of the 7 different programs as part of the Social Inclusion Ministry in terms of non-contributive pensions, and care for different users. Every 2 months, it includes 300 soles, and as we'll see later, it includes care. And the idea is to have an impact on people's quality of life. For this purpose, from the moment of creation, we have a few requirements. First of all, this is for people with severe disabilities. In Peru, disabilities are a condition that is assessed through the Ministry of Health, through technical standards, and they have 3 different levels: mild, moderate, and severe. Basically, this is linked to the autonomy of each person and their capabilities. The less autonomous a person is, the higher the level of disability, or the disability level. According to this criteria, they will be getting income or a pension. In Congress, we have approved a modification of this, and we have eliminated the part of income. It's only pertaining to the pension now. The third element we need to look at is to make sure that these people are under poverty or extreme poverty conditions. And this is ran through a focus system or home focus system. We have 2 services. There's the monetary aspect, the non-contributive pension, and then there's also a user-focused contribution for different homes. This is a general vision. This year we have 142,771 users, mostly men. This is not because we've selected them accordingly, but basically when we started matching the information, we had We had a random selection, and mostly it included males. We have indigenous people. We have different age groups also, and in different areas. And I wanted to point out that in terms of disabilities, the technical standards showed 6 different conditions, and under the Contigo program, there are more than 100,000, so all users need to have 2 or more of these different conditions for disability or attributes. And in Peru, we have this information that allows us to look at the situation in terms of disability in Peru. According to the National Home Surveys that was conducted in 2017, that was the latest, we identified over 3 million people who claim to have some kind of a disability. Sorry, some people are telling us that we cannot hear you. You're not too loud. Would you mind getting closer to the microphone so that we can hear you a little louder? Is that better? Yes, I think so. So I was saying that in 2017, according to the national survey, we identified over 3 million people with disabilities. This is basically as a result of self-assessment or self-reported, sorry. In 2012, that was the latest, that was the last survey, which identified 1.5 million before that. And then in 2023, we have the CONADIS, the National Council for People with Disability, according to which we had 519,000 people, over 519,000 people registered with disabilities, according to this, which gives them access to different public services, including free services, and different services that were also developed in the Ministry for Women. According to MIDIS, we have an estimate of the potential number of people that could be users of the social program, specifically for severe disabilities and those who are living in poverty. The estimate is 395,000. The Ministry of Health periodically submits information pertaining to people who have been certified as having severe disabilities. As you can see, it's almost 350,000. And according to the National Contigo program, we have identified 215,000 who would meet all of the different access requirements for this program. And out of those, 142,000 have been included as users in the program. So we have a gap of approximately 82,000 people who are still pending this care. Historically, this is how the program has grown. We started in 2015 as part of the Ministry for Women in 2 regions and 411 users, and then by 2024, 2025, we have 142,771 throughout the 25 regions in the country. This is the same information. This is simply a more user-friendly or more visual way of looking at the users and the calculation of the potential for coverage within this sector. The users of the Contigo program, as I mentioned, include certain disability conditions that are assessed by the Ministry of Health, and it includes 6, the highest levels 4, 5, and 6, are for people who have the greatest level of dependence, and all Contigo users include these conditions. We have 2 services. One, delivery of non-contributive pension, as well as the care. Regarding the former, this includes IT information that we look at in the Ministry of Health for those who have severe disabilities, and we look at pensions and income from a public standpoint, and then we look at poverty or extreme poverty for a system that's home-focused, external to the program, and then we match the information from an IT standpoint so that we can see who the users of the Contigo National Program will be, and then later on we include a contribution so that people can go to the bank or use the different means to make it effective. It can be done through different agencies, through cashiers, municipal channels, different models outside of the central system in different warehouses and stores, and even e-contributions or electronic contributions. Then we also have a care system, which is a need within the program. People with severe disabilities, as I was saying, have been certified because they have a higher level of dependence. So, as part of the systemic review and the evidence that we look at, we were able to determine that users of the Contigo program, people with disabilities, cannot be included as part of public benefits in an isolated fashion without looking at their home and their community. Thus, the intervention of this program must be aligned to these three different levels so that we can have an actual effect to improve life conditions on the one hand, and then the quality of life as an ultimate product resulting from this intervention. Let me just expand on some that are relevant. The first thing is we visit people's homes for care and for follow-up purposes. In terms of care, it allows us to show the rights for people with disabilities, for their families, for their communities, and make sure they're actually instilled. And then we have a follow-up visit so that we can make sure that people are keeping these conditions as users and for non-contributive pension. We have a national service, not for medical or psychological care, but to improve positive affection and also to look at negative affection growth amongst the users as well as their carers to make sure that they have the best possible conditions to work autonomously and to provide care. And we do this in two ways, in person as well as remotely, over the phone, as well as different platforms like Zoom that allow us access to remote areas that we were unable to access in the past because people normally don't have internet or phones, so we use other entities to try to reach out to this population. And we articulate efforts for by citizens, health, education, protection from domestic violence, and access to different support technologies. We have a Train the Trainers program for carers so that we can strengthen the care efforts. Given that we have very little time, I'm going to speed it up a little bit. Yes, we have 2 minutes left. No worries. So regarding the community, I'd like to clarify that we have an intervention called Galardon Contigo. It's a Contigo award, and this year we have 1,200 out of the 1,800 districts nationwide, where we are looking at a series of indicators for compliance. We're working with the local governments on this to check the impact on the perception of public services that have an impact on the quality of life of people, and we have an award, a public award or recognition for municipalities that have enough or noteworthy care provided. This articulates efforts between the public and private sectors because we are a program that needs to articulate private and public efforts within the sector so that the services can reach different people. People with severe disabilities in Peru don't have the health services because they're unable to transfer to the centers or because the cost is so high that they cannot go to these different centers. So we have the health centers closer to them. Having said all that, thank you very much, everyone. Sorry, I'm muted. Perfect. Thank you very much, Mr. Yes.